Well, it is the top of the hour. It may be different time zones, but we do start right on time here at Managed Healthcare Resources. And thank you all for spending an hour of your time to get with us. And as I was saying, for those that were on before, buckle up because we're going to be going through this. There's a lot of information that we want to share. When I've looked at whether there were other presentations out available that talks about the key differences between NCQA and URAC accreditations, I wasn't able to find them. And most people either have things about NCQA or have them about URAC. And so there are people out there we know who are trying to decide between the two accreditations, and it is just not easy to find that. One of our team members worked for one of our clients, and when they were going into accreditation, they were looking for what would be the best one for them. And there was nothing out there that they could really look at and compare. She said, this is like gold. And so you're going to be getting access to some real gold information from two people who have surveyed for the accreditors. We have backstories. We have a whole lot of information. So I'm Susan Moore. I'm the founder and CEO, and Lessely, who was worked for URAC as a clinical surveyor, clinical reviewer, is also here. Now, if you get access to the slides, which our clients and those who book a discovery call will have, this is copyrighted material that has taken considerable amount of time to compile. Please adhere to the copyright laws and not copy this or distribute them otherwise. Just to tell you a little bit about Managed Healthcare Resources, I incorporated it in January of 1991. And in January, if you do the math, we have been around for 35 years. And I've been preparing organizations for accreditation since the early 90s. And then and also added URAC because clients had both of those. And then when the Affordable Care Act went into place, I started limiting it to just NCQA because I've been surveying for NCQA since 1996 until this year, and I just couldn't keep track of all the standards. So in our portfolio, in our consulting team, we have mostly NCQA surveyors, and they also have worked for health plans for 6 to 28 years. In walking in your shoes if you're in the quality area and accreditation. And so they understand where people have been. They're not theoretical people, they're very practical people that help with our consulting. And then our URAC consultant recently surveyed for URAC for all but pharmacy accreditations. And so I gave you info about me, and I prepared organizations for URAC for 8 years. So it really was a good fit to be able to see both sides. And since I had worked on both of those sides for the consulting. And joining me today is Lessely Brown-Shuler, who has, and we're going to have to make bigger slides or make a smaller font for adding all of her credentials. But she was a clinical accreditation reviewer for URAC for 2.5 years until just a little over a year ago. So she's got a lot of recent experience under her belt and knowledge about what's going on at URAC now. And she's worked for over 10 years in quality with multiple types of organizations. So our vision, which really is our guiding light, is to empower healthcare organizations to reach their fullest potential through successful NCQA and URAC accreditation, driving excellence and raising the bar in healthcare quality standards. We really believe in the standards and are passionate about them. And I don't hire people to work with us who don't have that passion, but I say they don't have that quality DNA. So I only hire people who have the same passion for the standards, knowing that meeting these standards will help you be a better organization. So just so you know, both accreditors were incorporated in 1990, both NCQA and URAC. So they're both celebrating their 35th year in existence this year. NCQA, I don't know if you know how they were formed, but they were kind of organically formed from the Group Health Association of America and the American Managed Care and Review Association, which they eventually merged and they were renamed the American Association of Health Plans and now America's Health Insurance Plans, or AHIP. So the original purpose of NCQA from the Office of Health Maintenance Organizations was to perform quality review for that agency to make sure that the HMO Act of 1973 had components of quality and people could actually look at it, know that there was quality that was ingrained in those organizations, and they just weren't doing a per member per month amount of payment, but were actually doing what the HMO Act was actually geared toward, and that was for promoting preventive health and improving care in chronic diseases. And so the original intent was to create evidence-based standards and programs that could actually justify their existence. And they strove to be a trusted independent reviewer of quality. And so URAC was founded between representatives and the AMCRA, American Managed Care and Review Organization, which you saw was involved with NCQA. They were formed to address inconsistency in the utilization review process due to lack of standardization. And frankly, I was involved in this in operations in a managed care organization and knew that there was a lot of variability. So trying to avoid or get in front of a lot of regulatory requirements for utilization review across the U.S., they built the Utilization Review Accreditation Commission, was shortened to URAC in 1996 as they expanded their products. So saying utilization review was not reflective of all the products that they had. So URAC also works closely with state regulators to address managed care regulatory issues. And so a lot of these states would deem accreditation in lieu of having state licensure, where the state was involved in trying to regulate and monitor what was being done. They said, okay, we'll deem you URAC if people have that, and not require them to jump through a lot of hoops on the state side. And some reason it's not advancing. Hold on, there we go. So NCQA, when you're going to look at URAC accreditations, you're going to say, wow, NCQA doesn't have many. And frankly, it is really limited, but more comprehensive in the scope. So, of course, health plans and behavioral health organizations, mostly health plans, are the bread and butter. NCQA really owns health plan accreditation now. When the Affordable Care Act went into place in the teens, 85% of those organizations that had never been accredited before chose NCQA instead of URAC. And that kind of was a tsunami that limited or kind of changed the wave to NCQA being the go-to organization for health plans. And there's only 10 health plans that URAC accredits now. And so they went to a different model. But you can see behavioral health, case management, credentialing, health equity, health information product, long-term services and supports, population health, provider network, and utilization management, and wellness and health promotion. So they have other activities, data and IT, which everybody knows about. The Quality Compass, probably, that you can buy. It's pretty expensive. That gives you data across the United States on member experience and HEDIS rates. They also have digital content, and those are for benchmarking and setting goals, typically for most plans. Digital content services, they have a quality hub and HIT and data certification. The federal government owns CAPS, and NCQA has licensed that for all of those who have to be certified as auditors. And also, but HEDIS is owned by NCQA. They started that. I was actually on the predecessor reviewing since I'm in Southeast Michigan, reviewing a lot of the hospitals and the physician offices for HEDIS like measures, because in Michigan, of course, the auto industry is very important. So they wanted to make sure if they were paying HMOs to improve care, that there was actually some evidence of that. So I audited a lot of those records in this area. They also have some HIT pre-validation programs, such as for the population health, but you also have on there and appeals that can be built into those programs. And then there's measure certification that NCQA has. And then some of the ones that have lots of organizations, those are the recognition programs. I don't know if a lot of you know that, but there's diabetes, heart stroke programs where these individual practitioners and groups can get recognized for the way that they provide care for diabetics and heart stroke patients. They have a New York State patient-centered medical home that you can see there's a lot of people involved in that, and regular patient-centered medical home and specialty practice and virtual care delivery, which is different than URAC's virtual care accreditation. And then there's distinction in behavioral health care integration. And in the parentheses, I put the amount of entities that are recognized under each of these programs, just so you have an idea of the scope of that. So why don't you talk about the broad accreditation categories and then the specific ones?
Thank you, Susan. On the URAC side, we too have several programs. As you can see, we have different categories. We have pharmacy, which has about 10 programs in it. Patient care has 7. Administrative management, 10 accreditation programs. Digital health has 7. Health plan has 11. Mental health and substance use disorder parity has 3. There's a total of 48, but some are duplicates because they fit under different categories, but they all have their own specific standards per program. And if we move forward, we will then sparse out the programs under each tenet. For pharmacy, we have our specialty pharmacy accreditation, and URAC also has a specialty pharmacy accreditation for small businesses. It has the same standards of the specialty pharmacy accreditation, but it's for small businesses when it comes to pricing. So we can bring in some of the smaller businesses who would like to be recognized as well as being a great quality entity. We have specialty pharmacy service accreditation, infusion pharmacy, Medicare home infusion therapy supplier accreditation, mail service pharmacy accreditation, mail service pharmacy accreditation for small businesses, rare disease certification, pharmacy benefits management accreditation, which is one of their largest programs on the pharmacy side, and pharmacy service accreditation. Under our patient care management, which is where your nurses sit, we have health utilization management, workers' compensation utilization management, remote patient monitoring accreditation, disease management, case management, telehealth, and health contact center. For administrative management, this is where your community health worker program sits, your clinically integrated network accreditation, your health contact center, again, can sit here, health network, dental network, credentialing verification organization, independent medical examination accreditation, healthcare management certification, operates in healthcare that's not eligible for any of the other accreditations, but because you have a great structure and your policies and processes follow a different algorithm, then you're able to sit for that healthcare management certification. And then there's the employer-based population health accreditation. For our digital health and telehealth tenet, we have AI, telehealth support services certification, remote patient monitoring accreditation, health website accreditation, health content provider certification, and disease management accreditation. Health plan. Here are your 10 programs that fall under health plan. Health plan accreditation, which has several entities that I just showed you all under other tenets. It's several of these entities are embedded into the health plan accreditation, like your CVOs, your credentialing, your network. We have Medicaid health plan. We have Medicaid with long-term services and support accreditation, health plan with long-term support services, and health plan with long-term services and support, marketplace health plan, Medicare Advantage Organization Health Plan Accreditation for small businesses, a Health Utilization Management Accreditation, dental plan accreditation, Parity Manager software. And with that Parity Manager software, URAC holds the only accreditation for a software when it comes to mental health parity and health equity accreditation. So as I was speaking to you about that software, it also falls under your mental health and substance use disorder parity. So here it is, that Parity Manager software, which accompanies this mental health parity accreditation. They're separate, but they will work hand in hand. And here's your health equity accreditation again.
Thanks, that's a mouthful. And everybody can see there's just so many, and they're all these thin slices compared to the more robust, comprehensive accreditations that NCQA has. You know, it's like you have a need, you have an app for that. Well, you have an accreditation for that with URAC.
Mm-hmm.
So now we're going to go back and forth in comparing NCQA and URAC on all different areas. And so get ready because there's a lot of info in here. For a health plan, NCQA's product is comprehensive, and in one tool on the IRT platform, you can go for all 4 of those accreditations. If there's different information for Medicaid or Medicare, and typically with member experience and the materials that you send out and the rights and responsibilities, et cetera, those are different for Medicare and Medicaid than for commercial, but it's all in one tool, and then you just provide the differences in there based on what the product line is. But URAC's is a little different, isn't it, Lessely?
Yes, ma'am. Yes, ma'am. Health plan. We too have them segmented out: Marketplace, Medicare, Medicaid. They're all in Accredinet, that platform, Accredinet, but there are 3 different, however many products you decide to purchase, you have to submit documents for each and every product separately in that tool.
So that causes a little redundancy and probably irritation. I know that I would be a little irritated if I had to go copy and paste into every tool, but you know, that's just the way they do it. So for HEDIS and CAPS, it is integrated into the health plan accreditation. And so actually 50% of the score for health plans, and what gives it the stars are the HEDIS and CAPS results. And then it is also used for, it can be used for different quality performance in their analysis. And so you have that access to that can be used to meet the standards. And URAC is different.
Well, with URAC, the HEDIS information can be used in health plan, specifically in the population health segment of the health plan, and they can use this information for case management and disease management, which is standalone products. So we use it, they use it, but it's only for a small portion of the program.
And behavioral health for NCQA, the accreditation, it's a standalone, and it includes utilization management and case management in there. But URAC has something different.
For URAC, behavioral health and SUD parity, which are 4 programs, and then they have the behavioral health piece in your community health workers program.
Yeah, there's just no standalone behavioral health like NCQA has. Yeah, for case management in the health plan, it's limited to one standard in the health plan accreditation, and it's really not the full gamut of case management. It is specifically complex case management. There is a standalone accreditation for case management, and it is broader and can be, the entity can decide which one, if they want to accredit a transitional case management or complex or something that could be perhaps disease specific. They can do that in the standalone, but they cannot in the health plan. But for URAC,
we're 100% standalone for case management. It is not embedded in the health plan. It has its own program. Again, just like you just said, in the URAC room, you can decide which type of case management we would review for this particular accreditation, complex, positional, whichever one. You can actually bring in all facets of the case management.
And utilization management is integrated in the health plan. Also, of course, as I mentioned, in behavioral health, it is a standalone. The standalone standards generally are the same in there, but there's also a separate quality component that you have to meet, and talks about delegation and some of those other things that are added to the standalone that are in other places in the health plan, but the standalone, mostly the health plan utilization management standards. And that's a little different with URAC.
Yes, ma'am. Utilization management is that component is embedded into URAC's health plan product. And it's also a standalone program as well with benefits, medical benefits. It has two separate components as well when it's the standalone. You can either get an accreditation or you can get a certification. If your organization does not do its own appeals or send out its own letter, even if it doesn't do its own appeal, but it has to at least send out the letter, you will have to get a certification instead of an accreditation. That came about 2 years ago. And then there's another type of utilization management accreditation, and it's around workers' compensation.
And credentialing. There are the health plan credentialing standards, and the standalone has, similar to the area, some quality components for that. Just this last year, 2025 standards, they took away the CVO accreditation and embedded that basically in the CR standards. I tell you, it was kind of a pain to learn how the CVO standards compared to the regular credentialing standards that we would see for hospitals and also for physician groups that we did. But now they've just integrated them all into one entity. And URAC is similar.
It is. It has its own CVO program, and it has which can be standalone in a standalone program, and CR is embedded in the health plan. So we have credentialing in the health plan, but we have a standalone CVO program.
And population health is included in the health plan that was implemented in 2018, added to the standards. There is a standalone population health program accreditation. It is similar but different to the population health management PHM in the health plan standards. There are some components that are there, such as a strategy and a population evaluation assessment, but not a lot of the other ones that you see in the PHM standards. So there's not any auto credit that people can give except for, very small for that. So it's not really a high impact product, shall I say.
Well, for URAC, yes, ma'am. We have our population health embedded in the health plan, but we too have a standalone population health program, but it's called the employer-based population health.
Okay. Network management, this is a heavy hitter in the NCQA standards because there's a lot of analytical requirements in there, and the analytical requirements have 2 points instead of 1 for them. And then there's a standalone provider network, which only 3 organizations are accredited under. And if you have a provider network, it's in concert with the credentialing standards because it's for people that would have both a network and that they also want to credential. It's similar to the net standards, but not a one-to-one consistency there. It's kind of net light. And URAC.
So for URAC under network management, it is included in health plan, but they also have other network management programs like your clinically integrated program, your health network, and your dental network. So they took that network and they just put it throughout all the different types of services in the healthcare arena.
And then utilization management, I think this is a duplicate here. It's included in the health plan and standalone and URAC.
Yeah, it's same. It's included in the health plan, but we too have an additional in its workers' compensation.
Yeah, telehealth, I mentioned that NCQA has virtual care recognition, but not accreditation. But URAC,
URAC has a telehealth accreditation.
a separate one. Yep. Pharmacy. Now, pharmacy is one standard under the health plan standards. It is also included in the standalone standards because, as I said, they're just the same standards with a few additions when you get to the standalone. But URAC owns pharmacy.
Yes, 10 different related accreditations.
It's for every single little thing that you do under pharmacy, you can get accredited for. They just own that space. QA tried to start that. They did not end up doing that. Didn't get any traction because URAC owned it. Health equity. This was preceded in 2011 by the multicultural healthcare distinction. And then as we got into COVID, NCQA amped it up into health equity. And there are a lot of organizations in the United States that now have health equity accreditation. Before it was a distinction, now they expanded it. Its own standalone, but also they've included a lot of the health equity requirements into the health plan accreditation in the quality standards and in the population health program structure, assessment, and then of course, as I mentioned, the standalone.
And for URAC, it's a true standalone. And this came about in 2022. They really pushed it out. And it's one of their biggest programs.
So that covers contrast and comparison of the product design. And now we're going to get into recognition and approach, market recognition. And I put quotes here. Of course, I would have a bias as an NCQA surveyor for years, but this is what people have told me that have been exposed to both, that they feel NCQA is a higher quality because there's more rigorous look back periods that people have to adhere to. And as I mentioned, all but 10 health plans in the US have NCQA accreditation. But URAC is different.
Well, we're frequently chosen for our pharmacy benefit management programs. Specialty pharmacy. Specialty pharmacy is a big niche in URAC's pharmacy accreditation, and organizations, they feel the need to have this for the external quality validation. I'm going to go ahead and say it's easier. It's easier. We'll get into it. And we have, it's really based and it's geared toward more smaller products and it's more limited in scope. And Susan, there's a big difference with NCQA when we talk about easy and hard and limitations.
Yeah. So we won't beat that horse anymore. It's NCQA is perceived as more difficult and the accreditations are a lot more comprehensive. And for evaluators, such as my past life, we're called surveyors in NCQA.
And we are called clinical accreditation reviewers.
Because we'll get to who surveys for them. So people have said they feel that NCQA's approach is more punitive, but URAC prides himself on what?
Our educational stance.
And we'll talk about that a little bit in the next few slides. But if you're familiar with Avidas Donabedian's approach to quality in structure, process, and outcome in the three different areas, looking at NCQA, they're more process and outcomes focused. And Lessely?
And for URAC, we're more structure and process focused.
And not as much
outcomes. They're getting into outcomes now with the RPT standard for several of the programs, but that's just starting to hit the market.
So let's compare the structure now. The states where they're mandated accreditation for health plans, there are 27 that require Medicaid. Health plans serving Medicaid will be accredited by NCQA, and 7 others accept health plan accreditation as meeting broad accreditation requirements. So that's out of 50 states, that's 33 support NCQA. And URAC?
Well, for health plan, it's only 13 states that's mandated for URAC health plan.
Yes. So the standards, there are different time frames for standards. For NCQA, the standards year goes from July 1st of one year to June 30th of the following year. Health plans change every single year. Sometimes they're major changes, which 2026 have some major changes. And usually the off years have just tweaks. But then there's several other products that have not been updated for a while. And really it goes with a preponderance of people, organizations that have accreditation for those products. Like population health, there's only 27 and they've been in existence since 2019. Case management, they're in the 90s of entities accredited, but it takes so long. There's such a long process to update everything that for the smaller products that don't have as much uptake, they don't change as frequently. Credentialing and are two very vulnerable areas for members of the health plan because credentialing is a foundation and utilization management is where the rubber hits the road and when you're denying care. And so those two have been updated, I think, annually for the last 4 or 5 years, but not so with a lot of the other entities. URAC, what's
So
your
for
cadence?
URAC, the cadence is to update the program guides and the standards every 3 years. They try to keep it consistent. And the only time they would make a change outside of the 3 year cadence is when there's a regulatory change between the 3 years. And if there is a change, they will make the update, but the guide continues to keep the same version number. And then they still look at it again in that cadence within the 3 years just to see if there's anything else they need to make changes to.
So, as you might think, because NCQA's whole mission is to have transparency, you can get any of their standards for purchase on the website and just buy the license number for those who are going to use it. If you're going to have 5 people use it, you should buy a license for 5 people. They don't go and monitor that, but it's really on a basis of your honesty and who's going to use it. But it's very different for URAC.
Yes, ma'am. For URAC, for the standards, if you have not purchased a review, you will only be able to access a document by the name of Standards at a Glance. This is basically the standards and the elements within that particular standard are those standards. You will miss a lot because once you buy the review, you will then have access to the full guide. And in the guide, it has the standards, those elements I was just speaking about, but there's a section in the paid guide. It's called Interpretive Summary. It further breaks down what this standard is asking for and speaking about. It also has some more information around your desktop review, which is your first review that's what it's called when you submit your documents after you've paid for your review. And then it gives you information around your validation review. Your validation review is the second part of your review is when they come out and they make sure that they're validating that you're doing what you said you were going to do on desktop. So
Yeah.
you would miss a lot.
We're going to move ahead maybe a little faster because we don't want to run out of time. The accreditation span is the same for both entities for 3 years, and certification for NCQA is 2 years and URAC is 3 years. Now, NCQA is not fond of giving extensions because they get surveyors in place for the time frame. And so anytime you have an extension, it's going to be a fee. Every time, a few times they will waive it, but as you get closer, the fee goes up as a disincentive to make any changes in submission dates. But URAC has an
In your
extension
contract,
process.
yes, they do. In your contract, you'll see it's called a AAA. You have 2 extensions without a fee, and then that third extension, there's a fee for submission for the initial document. And if you're going for a reaccred, there is an extension. There is a fee for your extension for submission and also to delay your expiration date for the current accreditation.
So for surveyors, one of the differences is that URAC employs their surveyors, their clinical reviewers, but NCQA has 1099s unless they're NCQA employees that are involved in accreditation have to go do a few surveys a year. And NCQAs are physicians. There's always one physician on a health plan and a behavioral health. Most of the others are nurses. There are some non-nurses that also survey, but nurses are pharmacists for URAC. depending on the product line. Of course, pharmacists do pharmacy. And you heard us talk about the interactive review tool, the IRT, and AccreditNet as the platforms that are different, but they came about the same year. It was really interesting to see. Some of these things I really want to get into because they are very different. So NCQA has policies and procedures called documented processes, and they're not required for every standard. They could be a policy and procedure, or they could be a program description based on the scope of review. And you don't have to have a separate policy on policies, and you don't need to change your P&Ps unless there's a change in the standards. That standard requires a documented process, and therefore you have to modify it to get credit for it. But URAC is very
Yes, it is. We have a policy on your policies and procedure process, and it must be reviewed at least every 36 months. You can make it before, and if you were to make any changes, you would have to actually have when you revised it, when it was distributed, and effective date of that policy or any policies.
Yeah, look back period is very rigorous. You are not supposed to get credit if the standard says you must span the entire look back period, which is 24 months, let's say for that renewal survey. If you don't have a compliant policy in place at the beginning, you're not supposed to get credit for that at all, because that is considered functional, foundational for NCQA. Now they have different levels, interim or initial. It's typically 6 months of a look back period. Renewals are 2 years for non-file review and 1 year for all file reviews, except credentialing. That goes survey to survey, which is consistent with all the look back periods for URAC, isn't it, Lessely?
Yes, ma'am. Survey to survey for URAC for standards and files. You can modify your documents during the look back period. If, for instance, there's a change and you fall short, URAC will give you the opportunity to do a cap. Now, with that cap, you need to let them know if you know that there's an issue, because it's best that you point it out to them. And you may not get a full accreditation. You may get a less than full, which is like conditional, and they'll revisit and re-review in 6 months.
So NCQA has an annual requirement, and this will typically see for things that require a report and an analysis. Like any of your net standards require a lot of those, changing your quality work plan and your quality document and your evaluation or annual requirements. You cannot do an annual requirement like playing catch up for less than 12 months. It has to be at least 12 months apart. You can go to 14 months. There's a 2-month grace period, but that's it. 13 months, you're not supposed to get credit for that. But there's only one thing that's really annual for URAC, isn't there, Lessely? That's
Yes, ma'am. When
measures.
it comes to measures, they report annually. The measurement a submission window is from July 1st to September 30th. And that those are not for all programs, just the programs that has the RPT measuring it for reporting. Some of this the information that you're reporting for the measures, some programs require a validation from an approved company, and URAC has a list of those companies that they would like for you to use. And it's also a fee for submission, and it's a fee for validating using that company.
Yeah, and I think definitions are really important here, and that's why we're going over it, because this is what, when you go from one accreditor to another, is what really can trip you up. So there is a requirement in NCQA that we only apply the standards as they are. If there's a regulatory requirement that's stricter, then you meet those, then you're going to meet de facto NCQA's requirements. You're held to a regulatory standard if it's mandated or it's contractual. But I always say, in God we trust, everybody else has to provide data, documentation. So if there's a contractual reason that you cannot meet it or regulatory, then you can get exempt from an NCQA standard, but we can't just have you say NA because it's not applicable. Also, people think all the time that if the state doesn't require it for Medicaid, then you don't need to meet it for NCQA. That's a common misconception, totally wrong. So URAC is very strict on this.
Yes, ma'am. And just like NCQA, you must follow the strictest requirement. Now, if you want to make your own PMP more stringent, then we're going to follow your policies and procedure.
Yeah, so don't shoot yourself in the foot, really, to me. Providers and practitioners, I'll just go through this. NCQA is very specific that practitioners are warm bodies, providers are bricks and mortar, but URAC has historically used providers to specify everyone, which a lot of organizations do too, but NCQA is very specific. So make sure you take note of that. After documentation review, what happens? So this is the process. So the date that you have your survey is the submission date. That's when everything is due to NCQA. NCQA has it in their hands, the surveyors do, and a couple weeks later, they give you an outstanding issues form, which is OIF, and then you're allowed to take that and run with that. And there's a slide that I must have scooted over. Here it is. And this is really critical. We'll go back to the other, but standards clarification requests go to PCS. They can be submitted by consultants. And so that means you have an arm's length where it's not going to be connected to your survey if you don't like the answer. But that's not how URAC handles it.
No, URAC handles standards clarification by, there's an application and it's called interpretive inquiry. You have to submit your your question, or if you have an issue with a particular standards once you're in your review. Prior to the application, it would have to be answered by a customer relation manager, or after the application has been assigned, you can get it answered in an interpretive inquiry system. And it's just any surveyor or clinical review accreditation reviewer who is manning that box. So it's more vague, the answers are. So don't look for any specifics, because it's in writing and you have to be very careful.
Yep. So it's always connected to your survey, so you can't get away with anything. The survey process is done offsite with an outstanding issues form and then sent to the organization for review. And let me just go on this one. Then what happens is you have the OIF in your hands as an org. You develop the agenda for the conference call, and then subsequent to that call, you have 3 business days for documents that were available at the time of submission. You can't put any new documents in there. So there's going to be 2 or more surveyors, if complex, for file review, and 1 surveyor for smaller products. So let's go back to the whole process for URAC with the RFIs.
Well, with the RFIs, with recommendations for changes, that's when we ask for more information on in your documents. So in order to move forward from the actual desktop review, you have to score at least 100%. So when you get into it, Susan, go to the next slide. When you go into the survey and you submit, that's when your process starts with your reviewer. They will reach out. You have your introductory call and you schedule all your dates. You have round 1 of your RFI, and that's when we ask for information after we've reviewed your documents for round 1. If there are any questions, we schedule a call to answer your questions, and then you resubmit. There's a round 2. It all happens the same way. We review the documents after you've made your corrections. There's a call to clarify if we need more information, and then you submit your response for a second time. Now, if there is a round 3, a fee is attached to round 3, and you do not move past desktop review, which is where you submitted your documents, until you've scored 100%. Finally, once you've scored 100%, you move into your validation review stage. That's where we come out, or it can be virtually, but if it's a first-time applicant, you have to do on-site. So either way, we come out or we don't, and we interview, we go over documents, and we do file review. And it's 1 day, 2 reviewers.
And I'll just briefly go over IRR, the bane of everybody's existence. And there's no formal process for NCQA. There is an IRR tab for surveyors or organizations to designate in the IRT. And they do have a formal process at URAC, and there's an annual and potential during a survey. For file review, For NCQA, when you submit your application, you have to submit a universe for all different types of files, whichever is specified for that product. And then you get the randomized listing 2 weeks prior to file review. If you've not followed directions, and there's some of those that should be excluded, which people will find when they get them, or I would find them as a surveyor when I looked over the listing of ineligible files. NCQA's position is that they will not rerun that randomized listing unless it's really going to be detrimental to the organization. There won't be enough files. But URAC's very different in how they approach this.
Yes, we ask for file for your universe 2 weeks prior, and we choose from the randomized list, and we send it back to you with the decisions within 5 to 7 days before file review. But we would actually, if it's 15 files we're looking for, we'll probably go to 20 just in case something goes wrong with any of those files. We will have some additional already chosen.
So right after the survey, and I think the difference is that there's so much upfront time that URAC has, that they don't have this 10-day process where you can submit any errors, evidence that was available at the time of survey. So the only post-survey process for URAC is sending that notification of validations complete, and they'll find out the results in 30 days. So the process with NCQA after they get the comments back from the org is the executive reviewer reviews it to see if it should be incorporated for the review oversight committee, lovingly called the ROC, for a final determination. Now, big difference here is that when you are under survey, 10 weeks prior to your survey, you'll get a listing of all the potential executive reviewers and the review oversight committee, and you can identify any conflict of interest at that time so that those will be removed from potentially reviewing that survey when it gets to the ROC review. And a lot of people don't know that if you're getting about 99 or 100%, really good results, that only one ROC reviewer will look at it. The lower your designation, the more people that are going to review the survey. And typically for a denial, they have at least 3 physicians review that before they ever make a final determination. And URAC's very different.
Yes, the reviewer develops the executive review summary. We actually attach the tool that we scored you on. All this information is sent to the accreditation committee, who has to meet quorum to even meet, and the quorum is at least 8 of the members there for the meeting. The director is on the call, the reviewer is on the call, the reviewer gives her recommendation. The committee either says yes or no. If they say no, they say why, and URAC has 14 days to give the organizations their final results. And no conflict of interest where you can know who's on the committee it happens. It doesn't happen for URAC.
For committee reviewers, there are physician surveyors who are selected by NCQA and URAC industry leaders who could be competitors, but they're not identified. Nobody knows except internal people who's on the committee. Now, NCQA has no mid-survey monitoring process unless there was a cap, a provisional status, or there's reporting of fraud, and then they're going to come in and check. But URAC has a monitoring process.
Yes, it's mid-cycle. So it's and what they do is they randomly choose an organization. They notify you within 72 hours in advance that we're coming. We're only going to do documentation review and those file reviews and standards weighted in 8. No interviews.
So NCQA has a MAC survey process for mergers and acquisitions, and this is specified in the appendices of every single product that they publish. And URAC has even a change of office location.
Yes. And it's if you change your office, you are acquired or anything, you have to do a notice of change, and it has to be submitted to your customer relations manager after review. For if you have a change, it could spark a full review.
So this is just looking at, there's very different number of standards sets in NCQA. You'll see that there's only 6 here, and then there's some optional ones depending on state requirements. URAC has all of these different ones that you can see here that have standards listed underneath those. So automatic credit is an NCQA only concept. This came about in the early 2000s, and all of the surveyors were really up in arms about this initially, because it's really saying that if you delegate some of your functions that you're responsible for to another entity that has NCQA accreditation, and it is confirmed by your delegation agreement, which is why you need to be very, very specific in that agreement as to what you're actually delegating to the organization, then you can get it. It doesn't matter what the circumstances are, what the files look like for your survey. They're deemed as totally compliant, even if they're not, because NCQA is there and they're reviewing them every 3 years. And so there's a lot of push to make sure that anybody that a health plan, let's say, delegates to, that they're NCQA accredited, gives them that automatic credit. It cuts down on the risk that they have for the points to pass. So URAC doesn't have the same concept. Do you want to talk about that, Lessely?
Yes, ma'am. The only instance in which credit is given when is when a URAC accredited organization, for example, handles the appeal portion of the case. Because you have providers, you have one provider who did the denial, one provider who's doing the appeal. We just wanted to, and you're using a third party organization to do the appeal, believing and assuming that you've done your due diligence and to make sure that that provider's credentials are valid and within compliance. So that's the only credit you would get when you're record.
Now, I'm sure that all of you, as we've talked through these, are thinking these are decision variables that we would think about, such as staffing resources, how complex the standards are, how much it'll impact your staff. If you're not very long in the business, it may be more beneficial to have a URAC accreditation instead of NCQA, because they have stipulations on the number of files that you have to have processed by the time they'll survey you, and that could be a major barrier to you getting accredited. The degree of confidence, the quality of work that's being done in the organization, and as you look at the different standards, say, yeah, I'm not sure we're operating at this level, and so maybe we should go for something that's a little bit easier the first time around. And I say to people, if you really want to develop your infrastructure, URAC is good for that, for the structure and process components of that. It really is a good way to build a business. But if you really want to go beyond that and really prove your quality and the outcomes, of course, NCQA is probably the better way to go. If you want to have automatic credit capabilities if you're the delegate or you're the delegating one, you want to make sure that it's going to be a good fit there with what the organization delegating to, whose accreditation they have. There's regulatory requirements, of course. If you're required to have URAC, of course you're going to go after URAC. But most of the state requirements are allowing NCQ, and so you can choose which one you want. And of course, there are employers, business coalitions that will require accreditation of a certain type. So if you want to do business with them, then you would go after that one. So of course, URAC would make sense if state regs require URAC, especially if you're regulatory focused, because that's a big focus of URAC, as you saw with the parity, mental health parity, and some of these other things. And then, of course, if NCQA doesn't have that specific type of accreditation that you want to have, then you're going to go after URAC. And then, of course, first-time accreditations may find it a better fit with structure and process, and they have a certain amount of forgiveness the first time. And if you're new in the industry, you want to demonstrate operational excellence, but you don't fit in one of these categories, URAC has a certification for that called Healthcare Management Certification. So NCQA, same thing if state Medicaid or exchange program recognition is required and they specify NCQA. A lot of times, a lot of states have HEDIS and QI measurement for their Medicaid programs. And of course, it's a great fit with with the NCQA standards and gets you alignment. And if your organization's a health plan, specialty org, provider group, or behavioral health organization, NCQA as a provider has a product for, you'd want to go there. If you're a feeder into the health plan, NCQA health plan ecosystem, and you would provide auto credit from being NCQA accredited, that's a really good way to go. And of course, there's several companies that hold both NCQA and URAC for their smaller products, and they satisfy everybody, so there's no need to choose. So a lot of times you don't know, how do you find who is accredited? So there's report cards at NCQA, and you can click on health plans, and then you can choose by how many stars. You can search by name, by state, and you see here, if they're not accredited and what plan types they have. And then if you want to click on other healthcare organizations, all those smaller products, including behavioral health, everything really except health plans is in other healthcare organizations. And down the side, they specify it and you can click on that. They also tell you how many are accredited. So you want to know how many competitors would you have? Well, you see credentialing has quite a few there that are accredited. And that's really the highest because that's the most delegated standard set of any that works with the health plan. If you want to go to URAC, you go to urac.org. You'll see accreditations and certifications. And then there's directory down here. And once you click on it, you can decide if it's accredited or certified. They've got them separated out, so you may have to look on both sides for that. And you select a program under there. If you want to just see all, you can just hit search and it'll show you everybody. If you click on a program, they list all of them, and you see on the screen it will only take a few of them because they have so many, but you can click on that and see how many there are. And it will tell you how many total down here, and there's 10 per page, and then you can click if it's somebody that's at the end of the listing. You don't have to go through all of it and just click on 6 if they start with a W or whatever there. So we did get somebody asking in the questions, what do we do? And so we approach both accreditations the same way. We do gap analysis to see where you would fit, what your points would be if you submitted today. And we do gap mitigation, report and document writing, strategic direction, staffing assessments. We can help you decide, should you go for NCQA or should you go for URAC? Philosophy is that we teach you to fish and not fish for you, so that becomes part of your knowledge base. We don't want you totally dependent on us or really dependent on us. We want you to learn the standards. So therefore, we're going to coach, model, mentor staff on how to meet the standards, how to mitigate gaps, and do that on an ongoing basis of teaching you what the intent is. We also have lots of templates, tools, and trainings that are extensive for NCQA. And every week, Lessely is working on adding to our URAC library to provide those tools for clients. We do have lots of free content on our site, on blogs and FAQs and things that people would want to know. And we have past complimentary trainings on our website. For clients, we do have triennial change trainings, and we also have standards trainings. And you can find us at managehealthcareresources.com. And if you want to contact us through the website or at info@managehealthcareresources.com, we will respond to you within usually 12 hours or less, because we want you to see that we are responsive, and that's the way we do our business, and that's the way we respond to people. I know there was one question. Diane, did you want to bring that up or tell us what that is and see if we can respond to that? Otherwise,
Sure.
if you have questions that we don't have time for, just submit your question to the info@managedhealthcareresources.com, and we'll be glad to respond to you.
Sure. And this question came in from Julie. It may warrant a little bit of further discussion just by its nature. Julie asked, can you advise how to keep up with the intersection of health equity and our current government mandates and executive orders?
The intersection with that, well, there were some very specific things. We get asked this a lot and wondered if NCQA was going to give up health equity. The mandates and the requirements that the feds had was not requiring a lot of these things for your hiring and training. And that's why NCQA was giving some automatic credit on that in QI1. There is no prohibition for anyone to get health plan or health equity accreditation at all. And so I don't see that as being in conflict with the federal regs. And I've looked at that because our clients were asking us that. And I don't feel that there is a problem with that. So thank you so much for investing an hour and almost 10 minutes in the complimentary webinar today. And if you have any questions, you know where to go. And if you want to have a discovery call, just submit that through our website and we'll be glad to, or the email, and we'll be glad to set that up. And thank you so much, everybody, for attending and investing this time. We appreciate your interest in this.
Thank you.